Hi, my name is Aurora and I'm a cancer survivor. And this channel is all about how to get through the cancer and healing journey with as much comfort and ease as possible. After having had 8 major surgeries and losing 3 internal organs, I've collected a few tips and tricks for how to get through treatment and recovery with a little more ease so you can focus on things that matter most to you. And today I am going to talk about post-surgical lymphedema. And this can be very common and happen for a lot of reasons, and it's a big worry for breast cancer patients. Your lymph system is a system that runs parallel to your vascular system or your blood vessels. It's throughout your entire body, and the lymph fluid transports waste out of your body. But the human body has, for some reason, no automatic pump to make the lymphatic system work. Instead, it's pumped by our muscles when we move. So if you are sitting all day long, especially like you might need to be after surgery, they want you up and walking quickly for a reason, including blood clots, but also it helps your lymphatic system work when you're up and walking. But of course, you're going to have limited motion after surgery. But lymphedema is not just normal water retention that can happen if you sit for a long time. That's edema. It's not normal swelling that happens when you're like on your feet all day. It's a chronic retention of lymphatic fluid that can restrict your movement and it can cause really painful swelling. So post-surgical lymphedema can happen for a lot of reasons. Sometimes just because like I said, you can't move very much in recovery. Often it's because your lymph nodes need to be removed in the case of cancer, or the surgical procedure itself or the drains caused trauma to your lymph system. So this could happen in your arms or legs. For me, one of my surgeries damaged the lymph system in my legs around my knees. And this meant that fluid would collect from my knees down to the point where it felt like my skin would split and I couldn't bend my knees. And it took months of physical therapy to get to the point where I could bend my knees past the 90-degree angle and sit in a chair without pain. And I still have to use an electronic lymphatic pump every evening. And this helps to keep high mobility in my legs. And so it can be very frustrating and quite a struggle if you are suffering from lymphedema or having to watch someone you love suffer from it. So here are a few tips that I found that may help you to recover more quickly or more easily from lymphedema. So the first tip I have is to be persistent with your surgical staff in requesting a referral to a physical therapist that specializes in lymphedema. So if you reach week 6 post-surgery and your swelling is still so significant that movement is restricted, something's off. So once the surgeon's clinical staff has determined that you don't have an infection that's causing the swelling, there's no other like trauma in the area, there's not some other terrible reason why you're swelling. Once they've ruled all that out, it doesn't mean nothing's wrong just because they don't have an answer for why it's happening. So they need to refer you to a physical therapist that specializes in lymphedema. If the physician's assistant or nurse practitioner that you regularly see post-surgery, because you probably won't see the surgeon for every visit, is not willing to give you a referral, I recommend hopping on your MyChart and directly messaging your surgeon, which you should be able to do. In the United States, there's this platform called MyChart. I don't know how much it's used outside the US, but there's a couple of them. There's MyChart, there's Charm Patient Portal, and different platforms where you can click the person on your medical team or your surgical team that you want to email. I would do that and ask the surgeon to see if they could please give you a referral to a physical therapist. Usually they will, but I would be persistent in asking for that referral. The reason for that is that not all insurance companies will cover things to do with lymphedema, because even though surgeons have said that it's real and have been treating it for a number of years. Some insurance companies just don't really think it's real. So you have to be careful about who you get a referral to and why, and that it's medically necessary. And I'll have another video that talks about your legal rights if you have cancer and how to work with billing and insurance, but that's a whole another issue in itself. So tip 1, be persistent in getting a referral to a physical therapist for lymphedema. Tip 2, ask a lot of questions from your therapist about what your timeline will be. So the first thing that you'll do is you'll go in and have an assessment, and they'll take a ton of measurements of each leg. And they'll start you off with a series of exercises, gradually increasing in difficulty. And then you'll go through the series of treatment, and then they'll do a second measuring session. Be sure to ask exactly how long are you going to be doing these exercises before the next measurement session. Understand the results they're looking for and the timeline in which they expect to see them. Is this going to happen immediately? Are you going to do this for 6 weeks? And the reason for that is that it helps you mentally to understand that there is an end in sight, and they will have a point where they're going to call it done and say, this is as much as we can do. Ask up front what that is so that you can mentally prepare yourself for what's ahead of you. And tip 3 is do the exercises and wear the wraps. In addition to doing these exercises, you may have other treatments like TENS units, kneeling treatments, and definitely you will be wrapped in this really annoying mummy wrap that wraps every individual toe and your foot all the way up to your leg, up to your hip, if that's what if you're looking at lymphedema in your legs. So it can be uncomfortable and just a pain in the butt. Do it anyway. Even if the exercises seem silly and the wraps are inconvenient, because you will progress much faster if you do everything the physical therapist recommends. So depending on the body part, there'll be different kinds of wraps. I had to have, like I said, each toe all the way up, and it was unpleasant. But do it. It will work much better anyway than if you don't. Tip 4 is understand the different kinds of therapies that can assist you, so that if you feel like you're not making progress or you're concerned that things aren't going how the therapist described that they should go, that you can ask about doing other treatments. So some of those are TENS therapy, where they put, that's transdermal electric neural stimulation. That's what TENS stands for. So they're putting the little pads on your muscle and then giving tiny electrical shocks to help get the fluid flowing. There's lymphatic massage, there's wrapping, there's something called needling, which isn't really very pleasant. And understanding what the treatments they can do in office are, and understanding not only what will help, but what won't help. Because it can be really tempting to try cheaper methods that have been rumored to help with lymphatic drainage, like dry brushing or herbs. I was lucky that I had a physical therapist who was willing to research and look into any different like alternative methods. She was very open-minded, was not like Western medicine is the only way. She wasn't like that at all. She did not recommend dry brushing. It's not going to hurt you, but she didn't ever have it help any of her patients. And I have tried it. And honestly, the only thing dry brushing did for me was it's like a really good exfoliator. But it did not help severe lymphedema at post-surgery at all. It did absolutely nothing. A lot of the herbs people tell you to take are diuretics. So they're pulling fluid from your system and making you pee more. That can get really tricky post-surgery, because anytime you're increasing the amount of fluid that you're throwing off of your body, that you're excreting from your body, it can mess with your electrolytes. Most people that are healthy, that's not going to be a problem if they want to do that, if they follow recommendations and are careful with it and don't go overboard and do something silly. But remember, if you're post-surgery or you're ill, that's different. So be sure to ask them what are the treatments in office, like TENS and lymphatic massage, that might work. what do they think of things like dry brushing and diuretics? Because very often those don't work, or they can cause more problems than they're worth. So be careful with that. The mildest effective diuretic I know of that helps to get rid of fluid retention is spearmint tea, not peppermint, spearmint. And spearmint tea does equal lots of pee, but it certainly did not help with lymphatic drainage. It just didn't do anything. So if other people if you want to try it and it works for you, great. Again, it's not an indictment against it. It's not to say that it's bad. It's just saying for me it didn't work. Be sure to ask your physical therapist and doctor if you can do it, because in your particular case, it might cause more problems than it's worth. So always ask. And when money is tight for medical reasons, you don't want to go and spend a bunch of money on things that don't really have a large guarantee they're going to work. So my final tip is, after you complete all like the rounds of massage, the therapeutic wraps, the other in-office therapies, you've done all the things and taken all the measurements, and they're like, you know what? Yeah, we are where we are. You may be prescribed a lymphatic pump. I was prescribed a lymphatic pump, and these pumps can be really, really, really expensive. But most of the time, if they are prescribed by the right person, and this is why those referrals are really important, they can be covered at least in part by your insurance. So your prescription pump is your best bet. But if you can't afford it and your insurance doesn't cover it, I highly recommend asking your therapist, your physical therapist, what is the best over-the-counter option? Because I would never have guessed which ones would work well and which wouldn't. But she had some pretty strong opinions about it. I was lucky that I did have some insurance coverage. And so I got a pump that was prescribed. But it's not something you can wear around the house. You have to sit down and let the leg pump do its job for an hour. So if you're a big movie or television watcher, then you can just pump while you watch a show. Or if you're like me and you're always doing things, then it can be hard to fathom taking an hour for yourself to sit and do nothing while you wear a leg pump. But I recommend making a list of things you might like to do, but you never seem to have the time, like journaling or meditating, or writing or whatever, and incorporating that into your time where you're sitting with the leg pump on, if you happen to get prescribed one of those. So ask your physical therapist which one you should buy over the counter. If your insurance doesn't cover the prescription one, definitely go with the prescription one if you can, and commit to doing it. Definitely find something to make it worth your while to sit there and put the leg pump on. And I do take that hour to read and catch up on my planner and all of that stuff. It forces me to sit still and think and not always be running and doing everything. So psychologically, that can really help you to do a better job. So after you complete the rounds of massage, therapeutic wraps, your in-office therapies, all of that stuff, and your physical therapist says, we're done. This is all we can do. At that point, you may be prescribed a lymphatic pump. These are pumps that, for me, it was my legs, so they look like a giant sock that I put on and turn on the machine, and it pumps the lymphatic fluid out of your legs for an hour. And these pumps can be really, really expensive. Most of the time, if your insurance has durable medical equipment coverage, and if you are being prescribed this by the appropriate practitioner, which is why the referrals I was talking about earlier are important, then these pumps can be at least partly covered by insurance. If your insurance doesn't cover it, be sure to ask your physical therapist what is the best over-the-counter options before you decide to go purchase your own over-the-counter substitute. I was lucky my insurance did cover the cost of the pump, and I was at a point where I had already met my maximum for the year. And I'll have another video that explains about maximums and insurance and how that can work with a major illness, how that can work in your favor. But if that's not your situation and you need to buy one over the counter, I highly recommend getting the physical therapist's opinion on what to buy, and do not just go out and purchase your own based on reviews, because you don't want to waste your time and money on something that won't work or that will break very easily. And most of them will be happy to tell you which ones they think are the best option if you can't afford to get the prescription one. Mine is big. As you can see, it is not something you can wear around the house. You have to sit down and let the pump do its job. So if you were a big movie or television watcher, you can just pump while you watch a show. But if you're like me and you're always doing things, that it can be hard to fathom taking an hour for yourself to just sit and do nothing. So I recommend making a list of things you might like to do, but that you never seem to have time for, like journaling or meditating, and then incorporate those things into your sitting time when you're pumping, you're using the lymphatic pump. Then you can accomplish two things at once, and you're committing to taking care of yourself in a way that'll have long-term benefits, not just with the pump, but mentally you're reclaiming some time for yourself that you can do something. You're reclaiming something for yourself that a sickness took away. So I take that hour to read and sometimes to meditate, to set up my planner for the week, or to journal. And it kind of forces me to just sit still and think and not always be running around doing things. The manufacturers usually recommend that you set the pump up and leave it so that you're not always hooking and unhooking it, but it's not the most attractive addition to a room. So I don't disconnect the cords every time, but I do unplug the pump, wrap the cords, and then just gently stack it in a little storage bench at the end of my bed. So then it's not this weird, ugly thing when I'm like sitting in my room trying to relax or whatever. I'm like, oh, there's that pump. It's put away, but it's also very easy to just take out, unstack the legs and plug it in. So I found a compromise. So in that regard, my biggest tip is don't get discouraged. I know that's easy to say and hard to do, but it may seem like such a letdown to be so excited that, in my case, it was cancer. The cancer is out. I'm on the road to recovery. The reconstruction was going well. There were some bumps in the road, but now here's this other issue. And it's not going away anytime soon. And it's something that I have to deal with for the foreseeable future. So that can be depressing. It can be discouraging. But in the end, it's okay. It is everything. It's okay. In the grand scheme of things, I'd rather be forced to sit down and read and journal and perfect my Pinterest board or my planner for an hour before getting ready for bed than to have cancer. That's an okay trade-off. And sometimes my son will crawl up and sit next to me and we'll read books together. And that's a really precious time that I wouldn't have otherwise thought to create if I didn't have that pump. So if an ugly leg pump is the trade-off for being ill, or having to go through cancer, then I'm okay with that. So even on days when you feel like everything's going sideways and you're really discouraged, try to find one thing that's good, that you're happy to have. A loved one sent you cards, you have insurance, you have a comfy bed, you have your favorite tea, whatever it takes to just feel a tiny bit relieved and give you a tiny smile. That'll make things seem so much easier when you're having to go through the long haul part of recovery. So just also for some hope, I now can go, if I skip a couple of days without my pump, I can tell a tiny bit of difference, but it's not anywhere near what it used to be. It is getting better. I can wear my boots that go up to my knee again, and I can even fly and not have to worry too much about swelling during plane trips. So it does get better. There is hope. So there's a few tips that can hopefully help you navigate post-surgical lymphedema if you are unfortunate enough to have to go through it. And if you have a loved one that is going through it, just being supportive and asking them what they need from you, and sometimes just listening to them vent is the best way to help when they have those long-term recovery needs. So I'll be back with another video soon with some more tips and tricks. And until then, stay hopeful and take care of each other.